Hello, this is Dr. Harpinder Shevchenko from Smiles by the Sea Family Dentistry, and today I'm going to talk about dental exams. The very basic question that comes up is, what is a dental exam? So, dental exam, as actually the name kind of denotes it, it's like we are checking your teeth. We are checking not only your teeth, we are checking your gums, we are checking your mouth, we are checking your tongue, we are checking your cheeks, and we are looking underneath your gums. We are looking that by doing your x-rays. So dental exam actually is a whole big picture and looking at not only the teeth we see when we are smiling or the teeth we are chewing with, but really looking at the all the underlying substructures which make that tooth look there possible. What is included in our new patient examination? So we are a comprehensive practice. So in our practice, when patient comes in for a new patient examination, it's a very thorough examination because we want to know your mouth. We want to know what's going on in your mouth, what is present right now, and how can we help you get healthy. There's something going on, and all that is only possible for us if we are doing a very thorough examination. So the examination will include starting from we taking your full mouth x-rays. That way it helps us see the underlying substructures. How does your bone look like? How does the part of the tooth which is actually submerged in the underneath the gums in the bone, how does that look like? And you will get the x-rays first, then we will check the health of your gums. We do like little numbering system around the gums. That again tells us how healthy your gums are, or if there's something going on, what's the severity of that, what is the extent of that. And then we will also do your full evaluation, very thorough, looking with our eyes, looking into your mouth, checking for any cavities, checking for any lesions, checking also if you have any existing crowns or bridge work, or you have any dentures, or you have any fillings. We are looking what's the health of that. So basically we are evaluating and finding out what condition everything that is in the mouth is in. So it's a very thorough examination. We look at your neck, we look at your TMJ, we're looking at the joint, we're looking at your muscles. So it's a very thorough getting to know your mouth and the structures around your mouth. And also, a very important part of that is how our teeth are connecting with each other, because that really is basically our foundation, that how do they connect with each other, and that impacts the muscles that are helping muscles to chew us, and that in turn impacts on our jaw joint as well too. So also evaluating how your teeth connect with each other, how do they function, all that is included in your examination. What are some of the signs that a patient should see a dentist for dental exam? So here's, my recommendation, or this is my philosophy on it, is that, mouth, teeth are a big part of our health. So regardless of, even before we see any signs, the rule of thumb for the life should be that you want to be getting checked every 6 months. Go in every 6 months at least for your examination, get it checked out. But if you haven't been able to, for whatever reason, life comes in the way, or things happen, in that case you want to, if you're noticing bleeding gums, if you're having a tooth pain, if you're having a sensitivity, or you see there's something, some swelling happening in your mouth, or there's a lesion in your mouth, or your jaw is clicking, your muscles are too tight, your tooth is cracked, that will be a sign that you should immediately see a dentist for examination. How long do dental exams take? So dental exam can take anywhere from 10 minutes to 40 minutes, depending on, what are we evaluating? Are we evaluating you full mouth, or, it's an exam where we're looking at just one tooth or two teeth, so it can last anywhere from 10 minutes to 40 minutes. What happens if a problem is found during a dental exam? So if, let's say, there could be, nothing that is found, but there could be many things that could be found when a dental examination is done. Could be multiple problems going on, whether it's with your gums, whether it's with your bone or joint or teeth itself. It could be a cavity, it could be a gum disease, it could be infection. So we will give you a great explanation about it. Make sure you understand that. We'll explain you that what is the issue that is going on, what is the problem that is going on, and what might have caused it, and how we're going to fix it. So you will be given a good understanding about what needs to be done to fix that problem. There could be one solution, there could be 5 different options, and we will hold your hand, help you guide you through to the best solution possible for that kind of a problem. How often should I get a dental exam? So ideally, and also actually American Dental Association recommends as well too, that you should get your examination done every 6 months to keep things healthy, make sure we can handle things as they arise. What is good about getting my dental exams every 6 months, or as it's recommended? So there are many good things about it. As you know, nowadays our main focus is on prevention. So when you're coming in every 6 months, we are making sure that everything in your mouth is looking good. We are making sure that everything is looking healthy. And if there's something that is trying to derail from the health a little bit, we are able to catch it quickly. And what that means to you and to us is that, the problem is just starting and we can fix it very quickly, very less invasive, less money, less time, and much more predictability as well too. So that is the biggest advantage, that we can, if something is going on, we can catch it very early and fix it very quickly, less expensive, less intensive. And if you're getting off of your hygiene, we can also kind of like keep you accountable for making sure that you are doing things to maintain your health and just revisiting with you your oral health care, which is ultimately the goal. How much does a dental exam cost and what affects that fee? So the dental exams can vary anywhere from $50 to $175, depending on, there are different kinds of dental exam based on like what kind of examination we are doing, and that affects the fee as well too. And whether the x-rays are included in that, or are we using any other aids, visual aids or any other aids to help us with the examination. So that's what determines the fee. What should parents know about pediatric dental exam? So very first thing that I would say is, I know it could be very anxious for the patients to even understand that, oh my God, how the child will behave in the chair, or are they going to be anxious about it, and are they going to cry and all that. But don't worry, bring them in. We are using different kind of like a methodology or approach when we are doing pediatric exams, because obviously they are children and we understand all that goes with them being children and you being anxious about the examination, how they're going to behave. So we are going to be very friendly, make sure we keep them calm, keep them engaged, and using a lot of the terminology which is very kid friendly, and helping them through the appointment. And sometimes we even have smaller children sit in the parents' lap. So we have many different ways to keep it fun, keep it engaging, keep it interactive, and help you get through the examination. Make sure they get checked every 6 months as well too. Well, a dental exam always include a cleaning, and the answer to that is not always, because it could be that it depends what kind of examination you're coming in for, and based on that examination, that cleaning is a separate thing. So we are going to be doing your examination, and then based on what is the health of your gums, what is going on, and then we will determine what kind of cleaning you need. So it could be combined with your dental examination visit, or it could be a separate visit. So a lot of times when you're coming in for a new patient examination, because we want to get to know your mouth, we want to make sure that we are doing a thorough examination. We are spending a lot of time and going in detail, getting to know you and know your mouth, and then we bring you back in for a separate cleaning visit. So dental exam and cleaning, these are two separate things in general. I hope I was able to answer some of your questions about dental exams. If you have any other questions, we are here to help you. Please feel free to give us a call at 603-926-8827, and we'll be happy to help. Or you can also reach us through our website and send a form, and we will reach back out to you. And our website is www.smilesbythecnh.com, and we are here to help you.